Effect of sitagliptin on cardiovascular outcomes in type 2 diabetes. Definition: diabetes is a group of diseases with a variety of causes. The result is higher levels of blood. Diabetes type 2 is the most common form of diabetes. In diabetes type 2, our body does not use insulin properly. This is called insulin resistance. At first, pancreas makes extra insulin to make up for it, but over time it is available to keep up and can make enough insulin to keep blood glucose at normal levels.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Application in medicine. Sitagliptin is anti-hyperglycemic drug typically peptides for high individuals who prolongs the action of incretin hormones, including glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide by inhibiting their breakdown. This improvement glycine control in patients with type 2 primarily by suppressing glucagon levels and increase endogenous insulin secretion.
Hi, this is Tom from ZeroToFinals.com. I want to talk about two medications that are used in the treatment of type 2 diabetes. These are the DPP-4 inhibitors and the GLP-1 mimetics. So to start with, I just want to go through a particular type of metabolic process that occurs in the body in response to food. So imagine you have a burger here, and that burger is eaten and enters into the intestines. The intestines actually release something called incretins, and the main incretin that I want to focus on today is something called GLP-1. So in response to food, fats, carbohydrates, proteins, the intestines release GLP-1. And the GLP-1 is a very clever molecule. It travels around the body and it sends some signals to various different organs. The first and main organ that it targets is the pancreas, and in the pancreas it causes a rise in insulin and a drop in glucagon. Okay, so what does this mean for blood sugar levels? Well, if you have food entering into the intestines and this signal being processed to the pancreas to increase insulin and reduce glucagon, before you've even digested and absorbed that food, you're already starting to lower your blood sugar levels. So it means very good things in terms of keeping your blood sugar levels low. Now, what else do incretins do? Well, they target the stomach and they reduce gastric emptying. So what does this mean? It means that when you have a very large meal entering into the intestines send out this signal to the stomach to say, whoa, hold on a minute, slow down, let's process this a lot more slowly. So this means you get a very steady increase in glucose rather than in blood glucose rather than a very sharp increase. So this is good news for blood sugar levels as well. Now, what else do GLP-1s do? Well, they decrease appetite. So they're going to make you want to eat less hamburgers, less chips, less foods that are going to increase your blood sugar level. So all of these effects that they have mean very good things for keeping your blood sugar level nice and low. Now, we have an enemy to GLP-1s, and that comes from the cell. And on the cell membrane here you can see this transmembranous enzyme called DPP-4. Now, DPP-4 is a bit of a bad guy in this scenario. It sits on the cell membrane of almost every cell in the body and has an inhibitory effect on the GLP-1. So it stops GLP-1 doing all of these wonderful jobs that we want it to do, dropping the blood sugar levels. So as a result, the blood sugar levels will rise. Okay, so what can we do about this annoying little enzyme that stops all these good things happening? Well, we can give them something called sitagliptin. And there's various other types of gliptins out on the market, and I'm sure you'll come across them. But what these drugs are is DPP-4 enzyme inhibitors. So they essentially block the action of the DPP-4 enzyme and allow all of these good things to happen. Now, how else can we make use of these incretins that do all these wonderful jobs for us when we're trying to lower blood sugar levels? Well, we can give synthetic versions of the GLP-1s, and they're called GLP-1 mimetics. An example of one of those is exenatide. So exenatide is injected subcutaneously in the same way as insulin, and you do it twice a day before meals, and it has all the same effects as the GLP-1 itself. So there's a brief summary of DPP-4 inhibitors and GLP-1 mimetics. I hope that's been helpful in clarifying how these medications work. If you'd like more information, more notes, questions, and a blog, visit the website at zerotofinals.com. If you like the videos, why not check out the rest of them, and you can even subscribe to the YouTube channel. So I'll see you again soon. Thanks for watching.
Pros and cons. Pros: It doesn't have any cardiovascular outcome, is available in Ecuador. Cons: it has side effects, diarrhea, headache, nausea, symptoms of upper respiratory infection. Conclusion: among patients with type 2 diabetes and established cardiovascular diseases, adding sitagliptin to usual care did not appear to increase the risk of major adverse cardiovascular events, hospitalization for heart failure, or other adverse events.
Metformin and sitagliptin is a prescription medication used in combination with diet and exercise to improve blood sugar control in adults with type 2 diabetes. It is a combination product that contains two medications, metformin, a biguanide, and sitagliptin, a DPP-4 inhibitor. This medication comes in tablet form and is taken twice daily with food. Common side effects include diarrhea, stuffy nose, and headache. Take this medication only as directed. For more information, download the RxWiki mobile app.